Hello everyone, welcome back to Clinical Psychology Community UK. My name is Holly. I am currently an NHS assistant psychologist. This has been one of our most requested topics. It's all about using clinical supervision. What is it? What does it mean? How do I prepare for it? How do I get the most out of it? How do I get it? That's what we're going to cover today. You can find us on all of the social medias, and I'm going to be posting some resources that I mentioned today on the Facebook group, which I'll definitely link down below. It's the UK Declin Psy Applicants Reflective Space group. You can absolutely come and join us there, and all the resources from all of these videos can be found there as well. And don't forget to hit subscribe, and you will get all the notifications for all of the new videos and all of the stuff. Let's get straight into it. What is clinical supervision? What does it mean? Well, it essentially is a fancy way of saying meeting with a supervisor to discuss and support effective clinical practice. Essentially, that's what it is. A lot of stuff in psychology is actually fancy ways of saying stuff. It's essentially a chat with your supervisor. However, there is an ethical and professional expectation that psychologists will engage in supervision, and it's a requirement of practice. There's some BPS documents, British Psychological Society documents, as well as guidance from the HCPC and from ACP UK, Association of Clinical Psychologists. I'll link all of that down in the description. If you're interested, you can have a little look there. Essentially, clinical supervision is a massively important part of being a clinical psychologist or a pre-qualified psychologist, because basically it's all about development. Supervision sort of tends to involve discussion of clinical practice to ensure that we're all offering the highest quality care and treatment and interventions to clients. There's a promotion of reflection, learning and development. There's a promotion of self-care and best working practices, contribution to CPD of the supervisee and supervisor by developing competence in clinical supervision. It's all focused on getting us to where we want to be in terms of our goals and in terms of our job plans and things like that. Supervision is not a substitute for personal therapy or line management. It's a separate entity. Clinical supervision is there for you to have time, protected time, to talk to your supervisor about your work. It's massively important. What does clinical supervision look like? Well, I think there are lots of different guidelines around, and there are guidelines for assistants and for trainees particularly. And most of those suggest that at least 1 hour per week with a registered practitioner psychologist is the minimum that really needs to happen for us pre-qualified human beings. Quite often in practice that doesn't happen, and that's one of the challenges to supervision, is making sure that it's prioritised and that you're able to have that time, that protected time, and that is prioritised by both you and your supervisor. Generally, supervision can look like any of these things. It can be individual, like I said, it can be you and your supervisor sitting down and talking about stuff. It could be group supervision. So if there's, for example, if there's a group of assistant psychologists all doing very similar work with their caseloads, it might be useful for the psychologist to supervise all of those assistants in a group way, alongside individual, or as individual. It really depends on the service that you're in. And there's also peer supervision, which is different to clinical supervision. Peer supervision is more of a sort of support place, and tends not to include a clinical psychologist. So yes, absolutely, peer support, peer supervision is massively important because we can learn from so many people around us, but that is not a substitute for clinical supervision. You must be having that time with a practitioner psychologist. And the reason it's particularly for assistants and definitely for trainees is because the sort of work you do as an assistant and as a trainee is generally really clinically focused. And also, as an assistant and as a trainee, you do not have clinical responsibility. Your supervisor does. So they need to make sure that they're taking that time with you. The reason that there aren't these guidelines for sort of support workers or healthcare assistants is because it's not written into the job role. Essentially, an assistant psychologist is a role that only people looking to pursue a career in psychology will get. You don't become an assistant and then your actual goal is to be an engineer. That's not something you do. As a support worker, there isn't, generally they're lower banded as well. and it's not written into the job description. So you might not be working with psychologists, you might not be working in a psychologically informed way, that might not be the service structure, and it's not essential for your job role for you to get supervision. Essentially, that's the way they get around that, is because you're not employed as an assistant. And I think that's one of the reasons that assistant psychologist jobs seem like the golden ticket to getting onto training, because you get to have that time with a clinical psychologist. But that isn't to say that you can't make that time, and we'll get into that in a little bit. You definitely can make the time for that if you're in a support worker role. Let's go straight into the tips then. Tip 1, have a supervision agreement or contract. This sounds really formal and really fancy again, but essentially you want to have a discussion even about frequency and duration of meetings. How often are they going to be? How long are they going to be? Are we going to do it on Teams? Are we going to meet face to face? You need to have a discussion about that, really, so you both understand what the expectations are. What topics are to be discussed? Any goals for supervision? That could be, as part of your job plan or your, personal development review is what my trust calls it. And how many problems will be addressed? That's a really important part of it. What you can do, though, is ask your supervisor about it. If you feel unclear about what to bring to supervision, if you're not sure, ask. You're there to learn, and that's fine. Could just be a discussion, not a full-on contract. For example, I don't have a supervision contract, but at the first meeting we had a discussion about what my experience of supervision was, what I wanted to get out of it, that sort of thing. And it's okay to revisit that conversation as well, because I found that I've developed massively in the last year, well, over a year now since I started, and our supervision is very different to how it was a year ago because things change. So it's okay to revisit that conversation. But essentially, setting out right from the off what the boundaries are, what your expectations are, what the goals are, how it's all going to work, that can be really helpful. And the thing is with this is that it'll be different for everyone. I have 2 supervisors and they work in very different ways. So my sort of agreements with both of them are different. So it really depends on you and what you need, what your supervisor's like. Tip number 2 is preparation. Now, this is a massive, massive area, essentially. But what I'd encourage you to do is protect some time to prepare for supervision. Whenever I book supervision with my supervisors, I put it in, and then the half an hour to an hour before is always preparing for that and taking some time to really think about some stuff. And I've also always got a list of things throughout the week or throughout the fortnight that I want to bring to supervision. So when I come to prepare for it, I know exactly what I want to bring. So that would be helpful. If you're struggling, think about these questions. What do you want to get out of supervision? What is your goal? What are you trying to achieve? Is it that you're trying to achieve a place on the doctorate? Or is it that you're trying to get a bit more experience? Is it that you want to do formulations? Is it that you want to learn how to do assessments or therapy or a particular type of neuropsych assessment? What is it that you want to get out of your job and out of supervision? For me, it was a lot about modeling how psychologists work and understanding that how they have conversations and how they formulate ideas. That was really important to me to get out of supervision. So it'll be different for everyone. What feels important to you right now? What feels important to me now is very different to what felt important to me a year ago, 2 years ago, 5 years ago. But what feels important to you right now in your work? Are you stuck with anything? Are there any cases that you just think, I'm not quite sure how to proceed? What's the best thing to say? What's the best way to work? Did something go badly? Is there anything that you wanted to review? Did anything go really well that you want to talk about? That's also fine. Say, look, this went really well and I kind of want to unpick it a bit so I can think about how to bring it forward to future sessions. That's also helpful. How are you feeling in your role with your workload? That kind of gets a little bit line management-y, but actually it is also an important thing to discuss in supervision in terms of you being able to manage your own caseloads, your own workload, your own self-care, your own work-life balance. All of that is really important. And your supervisor genuinely will care, I imagine. what I'd encourage you to do is use some reflective models. I sound like a broken record. If you've ever listened to any of my other videos, that's all I talk about is reflective models. Use some reflective models and exercises to help you prepare. So it could be, we'll come on to some models of supervision, but it could be something like the social graces model. You might want to think about that and actually reflect on a case and maybe bring that to supervision and say, you know, I don't know if this relates. Just have that conversation. Using reflective models can help you make sense of your experience before you bring it to supervision. Because if you're trying to formulate what you think during supervision, sometimes that works for people, but it doesn't work for me. I like to make sure that I know where I stand so I can, you know, formulate it in a coherent way. But basically, make sure that you make time for this. You need to prepare. It's as important as the actual supervision. You really need to make sure. Because if you don't prepare, you're going to walk in there, you're not going to know what to talk about, you're not going to have anything on the agenda, and you're not going to get that much out of it. You know, this is only an hour a week, maybe even less, with your supervisor, where you can really learn some amazing stuff. So go in there telling them what you want to learn and what you want to work on, because that's the best way to do it. Tip number 3. I've also done a video on this, so I will link down below in the description. Keep a record of what you've discussed in supervision and your reflections. This was advised to me by my current supervisor when we first started having supervision. She said to me, keep a log because it will help you realize how far you've come and also prepare you for interviews and things like that, because you can see what you've actually learned from supervision and how you felt during it. And it's really interesting in reading my supervision log for the last year how much has changed. When I look back to March last year, I just think, wowzers, I'm a different person. And it's interesting to read. But basically, supervision logs are helpful because they help you plan for your next sessions. So when I'm planning my next session, I always get out my old supervision log, and look at the last entry. And I think, okay, so we discussed these things. These were the action points and these were my reflections. Did I get the action points done? Were there any extra reflections I have? Is there anything else that I want to bring? Was there anything difficult that I couldn't manage? And it helps you kind of form the basis of discussion for your next session. It helps you remember what was discussed. If you're like me, there are pages and pages of stuff everywhere because I have to have everything written down. I struggle to rely on my memory a lot of the time, particularly when I'm really busy or stressed. My memory is the first thing to go generally. So I try and write everything down, and it helps you remember what you've discussed. And if you're having it every week, you might be able to remember, but there might be little things that you don't remember. So it's important to do that. And more broadly, like my supervisor said, when you're preparing for interviews, I can't remember what I discussed in my supervision on the 8th of May last year. I can't remember that, but I will remember because I've got a log. So I know exactly what I've discussed. And it's helpful when I'm thinking about the lessons that I've learned in supervision and how to discuss that at interview. Yeah, and it helps you reflect on that supervision. And now I've actually sort of spent a bit of time thinking about how much I've changed in that last year, looking at the supervision log from a year ago and now. So that's really helpful too. And like I said, it helps you prepare for interviews. Yeah, so definitely keep a supervision log. There is an example on the Facebook group, which I will make sure I link the Facebook group down below as well. And there's also another video that you can have a little look at. Tip 4 is ask questions and be curious. So this is something that's taken me some time. I think historically I've always trained myself not to ask questions because I have had experiences when I have asked questions, people have gone, how don't you know that? Are you stupid? And that's not a nice thing. That's a really, really horrible experience, particularly when you're working in clinical psychology and you quite often feel that everybody knows more than you. And I'm sure you're looking at me thinking that, but you have to appreciate how much research and time goes into doing these things. Anyway, my point is, be curious and ask questions. That is what you're there for. You can ask questions of yourself. You can reflect out loud and you can say, you know, this happened and I felt this and I wonder why that was. Maybe it was this. Maybe it was this. I'm not really sure. Be curious. Ask those questions. That's okay. And that's, you know, what you're there for. Ask questions of your supervisor. Now, I don't want to put a lot of pressure on supervisors, but as clinical psychologists, we very easily put them on pedestals, I think. But they do have a hell of a lot of knowledge and experience. They've been in your shoes a lot of the time. They do know what it's like to go through what you're going through. And also, you know, they're there to help. They're there to support you. And depending on your relationship with your supervisor, fortunately, the relationship I've got with mine are very much let's get you onto training, which is hugely helpful. Some supervisors might not be like that, but you can ask questions of your supervisor on whatever sort of area of psychology you're working in, because they'll know loads of stuff, loads and loads. Ask questions about your service delivery models, your commissioning, the health board, the trust. Why are things done in that certain way? Are there any ways around that? Can we change things? That's how you kind of learn about the NHS and learn about issues facing the NHS, is having those sorts of discussions. And that's also how you can get stuff to reflect on in terms of, well, how do I feel about this service delivery model? Do I think that this would be better? You know, you could compare IAPT to what happens in Wales and Scotland, and you can compare loads of stuff. But asking questions about why things are done in a certain way can be a helpful sort of line of inquiry, if you like. I've been watching Line of Duty, so that's why I'm talking about inquiries. Basically, whatever questions come to mind, whatever you think, you can say them, you know, within reason, as long as they're appropriate and relevant. It's okay to do that, is my point. Ask questions, because that is how you'll learn. If you're curious about something, you can ask. I promise you it's going to be fine. And my last tip is be honest. Think about what your thoughts, your emotions, your feelings, your physical sensations, your relationships, any transference, any counter-transference. Think about all of this and be honest. Set yourself some boundaries. You know, what are you happy to share about yourself personally? What are you happy to talk about? Set those boundaries, because when we're in supervision, it's quite easy to want to give your whole life story, and you can find your boundaries slipping, very similar to when you're working with a client. But actually, if you set really clear boundaries and stick within those and be honest about what's going on, then you'll get most out of it. If you're honest, that is what you will get. You will get so much out of it if you can be open and honest. Personally, this took some time for me. It takes time for me to sort of settle into any job. I think it's true of most people, but it takes me quite a long time. And I think particularly in this, as it was my first AP job, I was so eager to show that I knew what I was talking about. And I didn't want them to think I was an imposter and that I shouldn't be in the job, and I wanted to impress them and things like that. So I didn't want to ask questions because I didn't want to sound stupid or like I didn't know what I was talking about. So it took me some time to let my guard down with that. And I'm so glad I did, because since this has happened, I've honestly got so much out of my supervision from being honest. And it's not that I was being deceitful before, it's just that I felt guarded. So try your best to break those barriers down, and maybe even name that in supervision if it helps you. Remembering that it's not personal therapy as well, but it's all related to how you are at work. You know, if I'm guarded in supervision, there's a chance that I take that guardedness with me to working with colleagues and working with clients. So it's an important thing to talk about. So those are my 5 top tips. There are loads more tips that I could talk about. And actually, I have included a question and answer section in this one because I popped out on Instagram. I quite often do question and answer things on Instagram. So go and follow us there. We're Clinical Psychology Community UK. And loads of great questions have come back. The first one I'm going to talk about is this. How can I access clinical supervision without paying for it? Yeah. So I feel quite strongly about this. I think it's really difficult because you should not have to pay for supervision. That should definitely be a part of your role. It's difficult if you're in a support worker or healthcare assistant role. As I said, it's not written into your contract. There are some ways you can overcome it, I think. What you could do, you know, if you're in a job where you don't get that, is make sure that you're in the right job, is the first thing. Because if you are working in a job like a care assistant where you're doing personal care and things like that, you wouldn't need clinical supervision. So while that experience is great and invaluable in working on building rapport and having those sorts of communication skills, and managing self-care and workload and loads of other valuable stuff, they're not going to give you clinical supervision because you're not doing clinical work in the same way that a psychologist or an assistant or a PWP or someone would be. So make sure you're in the right job. And if that means moving jobs, then try your best. Try your best to move to a job where there will be clinical supervision, or at least working alongside a psychologist. Because if you're working alongside a psychologist, it is much easier to get to know them and then say, would you mind giving me a bit of supervision? I can make sure that we can both get some time, and would that be okay? So that's another way. You can approach psychologists within your service or within your health board or your specialty, and see if there's anyone that will be able to offer you, even if it's once a month or something, or just something. That would be great. In the first instance, though, really, if your job, if clinical supervision would help you in your work, then I'd approach your line manager. You can have that discussion and say, look, I'd really like this. Or formalize it, put it on your personal development review, your PDR, your whatever it is, your annual review, put it on that, put it into your job plan if you have one. Really make sure that it's documented that this is something you want, and something that would benefit the service and benefit your clients. If you can do that, then it's a very difficult argument to argue against. So I would give that a go. Now, the other one that I had was what are some key models of clinical supervision? So I know all I talk about is models. I understand this. But there are a few models of clinical supervision and helpful tools out there that I'm going to talk about. I wouldn't say it's, they're massively essential. What I'd encourage you to do is talk to your supervisor about them, and see if there's any way that they could be incorporated, or whether it would be useful, or what their experience is of them, because they might never have used any. So a couple of them that are helpful is Stoltenberg and Delworth 1987 model. This one essentially is a developmental model of supervision. It is going to be our next webinar in April, so watch out for that. It's going to be towards the end of April. Essentially, it's a discussion around which category the trainee or the supervisee falls into. It's sort of beginner, advanced, intermediate, that sort of thing, on certain areas. But as I say, we're going to do a full webinar on that as well. There's one called the Friedlander and Ward 1984, and that is a supervisory styles inventory. So this isn't a model per se, but it is a tool. What it is, it's an inventory. Okay, so it's like an outcome measure, and it has loads of different characteristics like cold, warm, friendly, approachable, supportive, reflective, all of those sorts of things, loads of them. And you rate your supervisor from, definitely is reflective, calm, warm, cold, whatever, and definitely isn't. So you can rate them as to how much you think they match those characteristics. What you're supposed to do is get your supervisor to also rate themselves in terms of how they are as a supervisor. And then you discuss the results. You discuss whether there's any disparities and actually what would help you as a supervisor. Now that scares me a little bit to suggest doing that with my supervisor, but I think it would be helpful because, you can have that discussion. That might be more useful for when there might be problems and you don't feel like you're getting that much out of supervision, because it opens a discussion about what I need from supervision, basically. Again, we'll all be different what we need. And there's also one by Inskip and Proctor in 2001. Their one is all about how there are different tasks within supervision. There are 3 different areas, and one of them is dominant at any given time. And the tasks are support. So supervision is there to support someone in a restorative sense. Supervision is there for learning and growth, and supervision is there for monitoring of their work. So only one of those tasks is, in the foreground at any given time. So it's about, maybe you could take that as part of your reflection when you're thinking about how supervision went for you. And maybe in your supervision log, and you can say, actually, I think this was mainly a supportive session, or this was mainly a monitoring session, and actually I'd maybe like to have a learning growth session next time. So that's a way that you can use models. As I say, they're not essential like reflective models are. I think they can be really helpful for people, but I wouldn't panic too much that you're not doing supervision right if you don't use any of these models. I have never used them. Some people find them useful. I will make the templates all available on the UKD Clean Site Applicants Reflective Space Facebook group, which I'll link down below as well. Just to summarise, my 5 top tips for getting the most out of clinical supervision as a pre-qualified psychologist: have an agenda, contract, agreement, whatever you want to call it. Make sure that everyone understands where they stand and what supervision is going to be for. Prepare properly. Really spend some time, protect that time, thinking about stuff that you want to bring to supervision and reflecting on it. You will get the most out of it if you do that, I promise you. Keep a supervision log and with reflections in there as well, so you can have a record of exactly what supervision's been like for you. Ask questions and be curious. That is okay. It's what you're there for. We're there to learn, and that's okay. Be honest. Probably the biggest thing, really, is to be honest and as open as possible, and be boundaried as well. I hope that helps. Those are just some of the things that I found really helpful in learning what clinical supervision is and how it works best for me. So I really hope they help you. Give us a subscribe, give us a follow on all of the social medias, and catch up with us there. Thank you so much for watching, and I will see you next time. Bye.